The ear, nose and throat. Sounds simple, right? But these small parts of the body play a big role in our everyday lives. As a nurse, you'll see many patients with ENT issues. Knowing about these systems is key to providing the best care. Think about it. Our ears help us hear the world around us. Our nose helps us smell the roses, and maybe the not-so-pleasant smells too. And our throat, it lets us talk, sing, and enjoy delicious food. These systems are interconnected, so a problem in one area can affect the others. For example, an ear infection can sometimes lead to a sore throat. Understanding these connections and how to care for ENT issues is vital for any nurse. It's not just about knowing the facts, it's about improving your patients' lives. Let's break down these systems one by one. The ear is divided into three parts: the outer ear, middle ear, and inner ear. The outer ear is what you see, the part that channels sound waves into the ear canal. The middle ear houses the eardrum and three tiny bones that transmit sound vibrations. Finally, the inner ear contains the cochlea, responsible for converting sound into electrical signals that the brain can understand. Next up, the nose. This incredible organ filters the air we breathe, warming and humidifying it before it reaches our lungs. It also houses our sense of smell, allowing us to enjoy the aromas of life. The nose is divided by the septum, a thin wall of cartilage, into two nostrils. Finally, the throat, also known as the pharynx, is the passageway for both air and food. It plays a vital role in breathing, speaking, and swallowing. The tonsils, those lymph nodes you've probably heard of, are located in the throat and help fight off infection. Now that you know the basics of ENT anatomy, let's dive into some common disorders you'll encounter as a nurse. Ear infections, also called otitis media, are very common, especially in children. They occur when fluid builds up in the middle ear, causing pain, fever, and sometimes even hearing loss. Sinusitis, another frequent flyer in the ENT world, is an inflammation of the sinuses, those air-filled cavities in the skull. Sinusitis often causes facial pain, pressure, and congestion. And let's not forget about tonsillitis, the inflammation of the tonsils, often caused by a viral or bacterial infection. Tonsillitis can cause a sore throat, difficulty swallowing, and swollen lymph nodes. As a nurse, you'll need to know how to assess, diagnose, and treat these conditions. This includes understanding the symptoms, performing a thorough physical exam, and knowing when to administer medications or recommend further treatment. Now, how does all of this relate to your NCLEX? Well, you'll need a strong understanding of ENT to answer questions about assessment, diagnosis, and treatment. Here are some sample questions to get you started. 1. A patient presents with ear pain, fever, and drainage. What is the most likely diagnosis? 2. What are the common symptoms of sinusitis? 3. Describe the nursing interventions for a patient with tonsillitis. Remember, practice makes perfect. The more you review ENT concepts and work through practice questions, the more confident you'll be on exam day. And even more importantly, mastering ENT will make you a better, more well-rounded nurse, prepared to provide excellent care to your patients.